Freedom from addiction is called recovery. Successful recovery is a process that becomes a lifestyle. A popular misconception is that recovery is nothing more than willpower. Yes, resilience and resolve are important elements of recovery, but it takes a lot more than just trying harder. Yes, an addiction did start because of a bad decision, but it takes a lot more to unravel the consequences of that decision than just trying harder. These are the components of a good recovery program. We will take a look at each component. Recovery is hard work and takes a high level of commitment. The hard work does pay off in the long run, but first you must be ready to change. This is called being in the active stage of change. Dr. Prochaska and Dr. DiClemente of the University of Rhode Island in 1977 developed the trans-theoretical model of change. They examined and then went on to describe the changes that people go through on the path to change. The pre-contemplation stage. This is the stage where people are not intending to take action in the foreseeable future and can be unaware that their behavior is problematic. They may feel that they are bulletproof, that they do not need to change, or that they do not want to change. The contemplation stage is where they start to begin to recognize that their behavior may be problematic and start to look at the pros and cons of their continued actions. They think that maybe I might change sometime in the near future. The preparation stage. In this stage, people are intending to take action in the immediate future and may begin taking small steps toward behavior change. During this stage, they see problems arising that they do think that they will change in the near future, maybe sometime in the next. The active stage of change. These people have made specific, overt modifications in their problem behavior and are acquiring new healthy behaviors. During this stage, they are ready to change. They are taking steps to actively change. Resilience is needed to move from one stage to another. Much of the work of a recovery program is to enhance and foster resilience. So now that you have an individual who's ready to change, now what? Intake and placement occur early in the stage of recovery. This is usually a 2-hour interview done by a certified alcohol and drug counselor. The goal is to get the client into the most appropriate treatment setting. There are 6 main areas of evaluation in a complete intake. These areas are as follows. There's an assessment for any danger of possible withdrawal, particularly from alcohol or benzodiazepines. There's an evaluation for the presence of any complicating medical conditions like diabetes, heart disease, hypertension, or medical diseases that may be caused by the addiction that may need treatment or possible hospital or specialist. There's an evaluation for the presence of any significant psychological or psychiatric conditions like post-traumatic stress disorder, chronic anxiety, major depression, or psychosis. The rate of ongoing psychiatric conditions is very high in people suffering from addiction, and it is important that adequate treatment is provided. Some of these conditions existed before the addiction, and some are the result of the addiction. Both need to be treated. Evaluation of the stage of change. Are they in the active stage of change, as previously mentioned? And what is the likelihood that they will? Is there ongoing issues with drug use, including marijuana or alcohol? And is there a high likelihood of relapse? Needs to be an evaluation of the living environment. Is their living environment conducive to recovery? Is the home safe and supportive? Are there other drug users in the household or the neighborhood? Association with previous drug-using family and friends is a major factor triggering relapse. Recovery requires a bolstering of resilience. Much of what occurs in a recovery program has the goal of building up resilience and resolve. This is much more than just strengthening willpower. The drug of choice in the past was used as an artificial resilience builder. Now new ways need to be found and put into practice. The majority of my future videos will be focused on how to build resilience. Group work offers ways to build resilience in the following ways. Hearing other people's stories will often bring hope. Sharing your own stories to help others. A judgment-free environment where it is safe to ask for help and exercise humility. Learning tools to avoid relapse. Identifying with a new community, a community of recovering people. Boundaries are life-saving, and increased personal responsibility will be an asset for living a full drug-free life. Some of the important boundaries set by recovery programs include the following. No late arrival at appointments, no alcohol or marijuana, frequent urine drug testing, no early refills or refills for lost or stolen medication, and expectation of polite behavior. In the long run, the boundaries set by the recovery program are not as important as the personal boundaries that need to be established by the individual. Every patient is personally responsible for their own recovery. You are responsible for your decisions, your actions, and setting your own boundaries. The role of spirituality is important in recovery. The power of surrender to a higher power other than the higher power of the addictive drug. Spirituality also involves a more honest appraisal of one's personhood, not self-centered. The spiritual qualities of honesty, humility, and thankfulness are necessary to a long-lasting recovery. There needs to be an identification with a new group of people. It needs to be an identification with a community of non-drug dependent family and friends. This is a life of recovery, not just a 30, 60, or 90-day program. Success in a recovery program should be measured like success in a cancer treatment program, based on 5-year survival, and not just the ability to keep someone retained in a program for 3 to 6 months. Recovery from addiction also involves addressing resilience destroyers. Not only are there factors that are necessary to build resistance, it is also important to look at those factors that can rapidly deplete resilience and lead to relapse. Here are a few resilience destroyers that might need to be dealt with. A victim is powerless, living in a self-constructed prison. You need to be powerful to overcome addiction. You need to be the agent of your recovery and not the victim of your past. There is no freedom or progress while blaming others. Internalization of the victim role leads to bitterness, the feeling of anger and disappointment at being treated unfairly. This will drain resilience and leave you powerless. You need to let go in order to move forward. Forgiveness is viewing others that have caused you harm in the past as not owing you anything at this time. You are not expecting anything from them anymore. If you are waiting for them to right a previous wrong before you move ahead with your life, you're giving all of your power to someone else, someone who has hurt you in the past and is likely to hurt you again. Instead, forgive and move ahead with your life. Anger is the acting out victim. It is an exercise of pride and hurt and drains resilience rapidly. Fear is very limiting. It is often a source of relapse. It takes courage just to begin a recovery program. It takes courage just to walk through our office door and ask for help. Controlled confidence is helpful in early recovery, but arrogance will lead to a rapid relapse. The cocky do not succeed. There is a danger in believing that you have arrived. Humility is a present quality in the life of someone living a life of recovery. If a mental health issue is discovered, it needs to be treated properly. This may require a mental health referral, a medication change, or even a mental health. It is important that ongoing medical conditions are being addressed and treated. For example, the self-neglect that is often very common among addicts means that there has been little to no attention to personal health care. Chronic conditions have been left untreated. Uncontrolled cravings are one of the most common causes of relapse, especially in the early stages of recovery. Craving control can be accomplished in a couple of ways. Medication-assisted therapy, or MAT, can be very helpful in controlling cravings. There are multiple studies showing the life-saving value of these medical therapies. When given in the context of a recovery program, this is not just replacing one drug with another. These medications can control the distraction of cravings and withdrawal, while the important work of recovery can continue. Some examples of medication-assisted therapy are medicines like acamprosate for alcohol, methadone or buprenorphine for opioids. Being involved in a recovery program, developing a new social network, having a sponsor, learning how to recognize triggers and avoid relapse will also diminish cravings. With time, patience, and a lot of work, studies have shown a success rate of greater than 60% in a good recovery program. Like all chronic diseases, there are often setbacks or relapses, but with persistence, honesty, and humility, it is possible to live a life of recovery and experience a life free from addiction. For further references and additional help, please contact the Fractured Resilience website. Thank you.